What is health impact assessment? Our health is affected by decisions made in many areas, not just public health policy. For example, planning, transport, education, and housing. Health impact assessment, otherwise known as HIA, helps organisations consider the impact of their decisions on the health and well-being of the population to ensure that they are inclusive, equitable, and sustainable for everyone. HIA helps to inform policy and programmes. What are the benefits of health impact assessment? HIA provides a unique opportunity to modify new policies, laws, programmes, or plans before they are implemented. Organisations can use HIA to assess available evidence to make conclusions or recommendations, while also involving those who may be affected by their proposals. Any new proposal must enhance the health of an entire community. It should aim to reduce inequalities, improve health equity, and help those who are disadvantaged. This means considering how certain people might be affected. In 2018, the sugar-sweetened drinks tax was introduced in Ireland. The Institute of Public Health carried out HIA on this proposed tax before it was introduced. This is an example of a policy-level HIA. The public health priority for the tax was to support a reduction in the consumption of high-sugar drinks as part of Ireland's obesity policy and action plan. The tax prompted drinks companies to reduce the sugar content of products to offer consumers healthier choices. Who uses health impact assessment? Policy and decision makers across all sectors and organisations can decide to carry out HIA. Government departments or statutory agencies can use HIA to assess proposed laws or policies. Local councils or community and voluntary sector organisations can use HIA to health-proof future programmes or projects. What is involved in health impact assessment? HIA supports government strategies in Ireland and Northern Ireland to improve population health and health equity. The 7-stage process starts with a screening phase to determine if a full assessment is needed and ends with an evaluation phase. HIA can be used as a standalone assessment or to complement or inform other impact assessments, such as an environmental, equality, poverty, or human rights impact assessment. To find out more about health impact assessments, visit publichealth.ie/HIA.
Good morning, everyone. My name is Suzanne Costello, and I'm the CEO of the Institute of Public Health. On behalf of the Institute, I'd like to welcome you to today's launch of the 4th edition of the Health Impact Assessment Guidance, and to thank you for taking the time to attend. We appreciate this is a very busy time for everybody. This launch is the culmination of almost 2 years' work led by my colleagues, Dr. Helen McAvoy and Dr. Joanna Purdy, and the policy team at IPH, with invaluable input from leading thinkers and practitioners in health impact assessment, both home and abroad. We very much appreciate their generosity and collegiate approach, and we look forward to hearing from some of them this morning. To start things off, Robin Swan, MLA, Minister of Health in Northern Ireland, and Frank Feehan, TD, Minister for State with responsibility for public health, wellbeing and national drug strategy in Ireland, have recorded some brief opening remarks which we will hear now.
Good morning. I'm delighted to be able to join you virtually today at the launch of the 4th edition of the Health Impact Assessment Guidance for Ireland and Northern Ireland. And I thank Suzanne and colleagues from the Institute of Public Health for their invitation. I see there's a full programme scheduled this morning, and I welcome both presenters and attendees here today. I would like to start by acknowledging the tremendous amount of work undertaken by Suzanne and her team, who have collaborated with the international experts over the last 2 years to get us to this point today. The work of the Institute for Public Health and this updated guidance complements our Making Life Better strategy, which is our executive's overarching strategic framework for public health. The Making Life Better strategic framework commits us to creating the conditions for individuals and for families and for communities to take greater control over their lives and be enabled and supported to lead healthy lives. The framework itself provides strategic direction to guide the development and implementation of collaborative action at government, regional and local levels. And in addition to promoting collaboration with central government, Making Life Better sets the direction for the public health element of community planning. The framework itself has been developed on an evidence-based theory of change. The ecological approach, this clearly recognises that health and well-being and health inequalities are not just the outcome of clinical services we provide, but are in fact primarily shaped by factors including age, family community, workplace, benefits, traditions in physical and social environments. The COVID-19 pandemic has had profound impacts on health and well-being, and the evidence is showing that the consequences of the pandemic could be driving further health inequalities. Therefore, it has never been more important for us to continue to work collaboratively to address these issues. We need to work together to help create the conditions to allow people to make healthy choices, enable early intervention, support those people who become ill to recover, and to maintain good health into the future. I believe that by continuing to work together, we can create the best health outcomes for us all. The many benefits of the new Health Impact Assessment Guidance will be discussed further today, and I fully support the process as a valuable mechanism for informing future decision making. I'm sure you'll find this event interesting and informative, and I hope you all enjoy the morning.
I am delighted to have been asked by the Institute of Public Health to launch the 4th edition of the Health Impact Assessment Guidance for Ireland and Northern Ireland. The Institute is a vital partner in the development of health policy in Ireland, particularly in light of its role as an all-island body. This new edition of the guidance has been developed by the Institute of Public Health to support people working in various roles and is useful both for those who are new to the Health Impact Assessment or HIA and also those who already have experience. The guidance will help all users navigate the steps of HIA and is both practical and flexible. While the guidance is for Ireland and Northern Ireland, it also factors in elements of wider European, UK and various other international best practices. The Health Impact Assessment is an important process that can be used to improve the health of communities and, crucially, to reduce health inequalities. By focusing on the importance of health impacts in all communities, HIAs may allow us to understand the positive health impacts of a project or new policy. They also allow us to actively take steps to improve the health and well-being of the population by taking into consideration the health implications of new proposals. It can be applied at project level or at a strategic level to regulations, policies and programmes. This guidance is particularly useful to support government and the civil service. It can help to prevent negative health consequences by anticipating them. Healthcare is one of the most complex areas of activities to work in, and I have no doubt that this guidance will be of great assistance to anyone seeking to develop health policy and proposals. It only remains now for me to thank everyone for their hard work in producing the guidance. Thank you.
And thank you to both ministers for taking the time to input to the event and for their ongoing support for the Institute. I'd like to move now to the main part of this launch. In a moment, I will introduce my colleagues, Dr. Helen McAvoy and Dr. Joanna Purdy, who, as I said, have led this work, and they will provide an introduction and policy context for HIA and give you an overview of the guidance itself. I'd particularly like to thank Helen and Joanna for the work they've done on this guidance, which is a significant contribution to helping create the healthier environments that will help enable people and communities to improve their well-being and their lives. Helen and Joanna will be familiar to many of you, but for those of you who don't know them, let me introduce you. Helen is Director of Policy at the Institute. She has contributed to reports and policy papers on inequalities in maternal and child health, fuel poverty, tobacco, alcohol, and health inequalities. Helen graduated from Trinity College Dublin with a primary medical degree in 1997 and worked for several years in both hospital and general practice. She completed her MD in 2000 as part of the Masters in Health Promotion Programme at NUI Galway. Joanna is Public Health Development Officer at the Institute. Her role involves the synthesis and interpretation of evidence to inform public policy. Joanna is involved in the development of consultation responses and engagement with the government committees on key public health issues and the review and evaluation of public health policy. Joanna obtained a BA in Consumer Studies and a PhD from the University of Ulster. So Helen and Joanna, over to you.
Thanks very much. Good morning and welcome again to this launch of HIA Guidance for Ireland and Northern Ireland. My name is Helen McAvoy and I'm Director of Policy at the Institute of Public Health. Before my colleague, Joanna Purdy, brings you through the suite of guidance documents that we're publishing today, I'm just going to offer some reflections on HIA on the island of Ireland to date and the potential contribution of the new guidance to better decision making for health. A decision was made in late 2019 to revive the work of the Institute of Public Health in HIA. We were really inspired by the work of Public Health Wales and indeed Public Health England, as well as some progress that was happening in Europe and globally. Our first priority was to update the 2009 HIA guidance in line with the new policy and regulatory contexts, including at national level in EU and international developments in HIA practice. The work that we're doing builds on a previous program of work operated by IPH in the early 2000s, which included the development of guidance, a HIA training program, an online HIA resources platform, and hosting of HIA workshops, as well as a global HIA conference. IPH staff have continued over the past few years to deliver training on certain courses, including the MPH in Queen's University Belfast. And as you will have seen from the video, we led on a policy level HIA on the introduction of a sugar sweetened drinks tax in Ireland, as well as supporting a HIA on the Dove Gardens regeneration project in Derry. Other assessments completed at this time included the Public Health Agency-led HIA on the Regional Cardiovascular Services Framework. This focused on how the design and delivery of the cardiovascular service could better address health inequalities. And programme level HIAs were also conducted on transport planning in Ballyfermot, on community gardens, and on accommodation options for the travelling community. So where we are now, I think policy-wise in Ireland and Northern Ireland, is that there is an increasing focus on health equity. The recently published Healthy Ireland Strategic Action Plan added health inequalities as a standalone theme. I believe that the new guidance will also be of particular use to those stakeholders working on the existing Healthy Ireland themes of governance and policy, partnership and cross-sectoral working and empowering communities. I'm really hopeful that the guidance will be of use to people working alongside and within the Healthy Cities and Counties network, in county and city development plans, and in other decision-making roles linked to local government. In Northern Ireland, the Making Life Better framework recognises really clearly that health is influenced by decisions on housing, transport, social protection, employment and environment, decisions that are made outside the health sector. HIA can support the vital work already underway on community planning. It can also contribute significantly to the proposed integrated care system for Northern Ireland. Within the proposed area integrated partnerships boards, these new boards and the new integrated care system were intended to design health systems better matched to local needs and create far more porous organisational boundaries for the sharing of knowledge and resources. So here we are in November 2021 at a most interesting and challenging time in public health in Ireland and Northern Ireland, and indeed globally. In the week of COP26, governments big and small are faced with the unfortunate fact that we are exceeding our planetary resource. What's good for health is generally good for the planet. Breastfeeding, active travel, better air and water quality, a food system that nourishes people above profit, and lower tobacco use. We must capture the co-benefits from the health improvement and sustainability agendas, and HIA can help us. I hope that the guidance will be used to integrate public health into decision-making in the context of these national and global challenges, and to help in the reset of priorities in the recovery phase from the pandemic. I hope the guidance will support, but I also hope it will drive real change and innovation. To do so, it must be a tool that can also disrupt and challenge, placing health centre stage rather than a peripheral concern in national and local decision-making. I'd like to extend my personal gratitude to the policy and communications teams in IPH who worked so hard on the development of this guidance, and special thanks to Joanna Purdy, who's been leading on the work over the past year. So over to you, Joanna.
Thank you, Helen, and good morning, everyone. I'm delighted that so many of you have joined us today for the launch of the updated Health Impact Assessment Guidance. As Helen has already remarked, today really marks the climax of 2 years of work, and really is our pleasure to be able to present to you a new suite of HIA guidance documents. Just over the next 10 minutes or so, I would like to highlight for you how the guidance was developed, talk you through the suite of guidance documents, highlight for you who the guidance is for, what's new about this guidance, and just to give you a brief overview of the main stages of health impact assessment. So firstly, just to kind of guide you through the development or the process around the development of the guidance. At the outset of this process, IPH developed a specification for updated health impact assessment guidance. And as part of that, we embarked on a procurement process to identify a suitable provider to work with IPH to update the health impact assessment guidance. In August 2020, we engaged HIA consultants Ben Cave and Ring & Piper from BCA Insight Limited to undertake this work for IPH. In the autumn of 2020, we developed the first draft, the first draft of the guidance was developed, and at around the same time, an HIA advisory group was established. This group comprised a wide range of stakeholders who kindly provided written feedback, and we then convened an advisory group meeting to further discuss and really flesh out some of the thoughts and perspectives on the guidance to take account of those wide-ranging views. In the following months, after we took account of the feedback, the guidance was revised and refined, again, based on the input from the advisory group and from a panel of external reviewers. So here we are, we're delighted to present to you a suite of updated HIA guidance documents. These are now currently available on our website at the link shown, publichealth.ie/HIA. I just want to talk you through each of the guidance documents. So we have a manual, we have technical guidance, we have a plain language summary, executive summary, and we have another document which just sits a little outside of the core guidance documents entitled The Case for HIA. I'm sure it's fair to say that many of you here today are particularly interested in the manual and the technical guidance. These are interactive, user-friendly documents, and they allow the reader to move between the two documents. So for example, if you're reading a particular section in the manual, there will be links, hyperlinks that will take you to the section in the technical guidance, for example, which will have more information on that particular aspect of HIA. So very user-friendly, interactive documents that are available on our website from now. So just to talk a little bit about each one in turn. The manual sets HIA in the policy context of Ireland and Northern Ireland. It provides a practical framework for HIA as a standalone assessment tool and as health within environmental assessment. The manual also explores health inequalities and health equity in more detail, and it also provides an overview of the HIA process. Guidance, as the name suggests, provides more technical detail on how you actually undertake a health impact assessment. The technical guidance is set out in 6 parts, which broadly reflect the main stages of health impact assessment. And within the guidance, we have a series of practical tools and materials which are ready to use in real-world situations. The executive summary answers a number of questions for readers. It sets out what HIA is, who the guidance is for, what it covers, and how it interfaces with other impact assessments. We then have a shorter plain language summary, which is accessible to a wider readership. And as I mentioned a few moments ago, we also produced a document entitled The Case for HIA. And whilst this is not specifically a guidance document in and of itself, what it does do, it seeks to promote the use of HIA and sets out the future direction for health impact assessment across the island of Ireland. So who is the guidance for? Well, broadly speaking, the guidance is for organisations that are developing legislation, policies, plans or programmes. It can also be used by planning authorities and developers who are either seeking permission or wishing to grant permission for a particular individual project. Each document is targeted at different readership. Each document has a different level of complexity and technical detail as well. The plain language summary has been developed for the general public. The executive summary is for leaders whose decisions can either directly or indirectly affect the health of populations. The manual is for commissioners, i.e. those who are commissioning, inviting tenders, or indeed procuring the delivery of health impact assessment. And then we have the technical guidance. And there are primarily two main audiences in mind for this particular document. Practitioners who will be undertaking standalone health impact assessment, and also health stakeholders who have an interest in or will be involved in health impact assessment, such as public health teams. So what's new about the guidance? Well, firstly, the guidance provides direction on undertaking a standalone HIA, as well as looking at the wider health determinants within environmental assessment. The guidance is relevant to Ireland, the UK and Europe, and the guidance demonstrates that there are statutory, policy or voluntary drivers for health impact assessment. The updated guidance explores health inequalities and health equity in more detail than the previous guidance did. There are some unique features to the guidance, and I just want to talk through these for the next few moments. Firstly, the guidance shows how both health impact assessment and health and environmental assessment follow the same systems, process, and approach. The guidance provides a detailed explanation of each stage of the HIA process and the practical tools that are available to support its implementation. The guidance navigates the reader through what we describe as 4 intersecting dimensions of HIA. That is, whether it is a strategic or project level HIA. And when we talk about strategic level HIA, we mean a health impact assessment that would be conducted on either a new piece of legislation, new policy, plan or programme, and then separate from that, a project level HIA. It also intersects with what we describe as either a checklist or a full assessment, whether we're reporting as a standalone HIA or as health within environmental assessments. And we know that EIA, environmental impact assessment, and strategic environmental assessment have their own reporting mechanisms. So this sets out how health can be set out within, can be reported within those existing structures. And also whether the assessment is in the policy and legislative context of Ireland or Northern Ireland. And finally, the guidance outlines the relationship or the interface with other impact assessments, such as equality, human rights, or poverty impact assessments. Finally, I would like to give a brief overview of the main stages of health impact assessment. And these apply at either that strategic or project level that I've just described, and they also apply to the standalone HIA or health and environmental assessment. The stages can overlap. For example, the scoping stage really needs to be kept under review over the course of the HIA, as new information can come to light or emerge that may impact on the overall scope of the health impact assessment. So it's important to consider that if new information emerges. If you're already familiar with the HIA process, you'll probably see from my slide that the appraisal stage, which was in the previous iteration of the guidance, has been updated and replaced with 2 additional stages, analysis and reporting. And I'll say a little bit more about those in a moment. So firstly, I'm just going to kind of take you through each of the stages, and many of you here today will be very familiar with the stages of HIA. But for those of you perhaps who are less so, we'll just have a whistle-stop tour, so to speak, of the health impact assessment process. So the screening stage is the first part of HIA, and this is the stage at which a decision is made about whether to conduct a health impact assessment. This decision can be made on a case-by-case basis, or it can be as a result of a statutory or policy requirement, in which case the decision is automatic. Then we have the scoping stage. This would have been referred to almost as the blueprint for the HIA, and this sets out the governance arrangements for the health impact assessment. And it's also the point at which the health determinants, the populations that you wish to consider, and the methods that you're going to use are specified. So it's really outlining what the health impact assessment is actually going to look at. Then we have the analysis stage, which is a significant stage in the process. It is at this point that evidence on the potential effects on health are gathered, and that evidence is then used to inform the conclusions and recommendations. Both qualitative and quantitative data collection methods can be used at this stage. And what's really important to remember, this stage involves determining the significance of the health impacts on a particular community or population. We then move on to the reporting stage, and it's at this stage the conclusions or recommendations are presented to the decision makers, and they should include a focus on health inequalities and health equity. The next important stage is the implementation, and in order for the health impact assessment to be effective, findings from either a standalone HIA or health and environmental assessment should be followed up when implementing the proposal. And what I would also say at this stage is that health impact assessment can really support the delivery of the public health frameworks in both Ireland and Northern Ireland, Healthy Ireland and Making Life Better. And with the same token, those public health frameworks also provide the mechanisms for implementation of any recommendations emerging from a health impact assessment, or indeed mitigating any negative health impacts that have been identified. The penultimate stage in health impact assessment is monitoring, and this is the point at which, after the initial HIA report has been issued, that there will be further collection or examination of data to really ascertain what impact the HIA has had in terms of the proposal. And this can be conducted at different phases of the legislation, policy or programme. It's about really tracking the effect. And then finally, we have the evaluation stage. And evaluation, I mean, is so important and can often be overlooked, or insufficient time or resource dedicated to it, but it is an extremely important part of the HIA process. And it can be conducted in three ways. We can have a process evaluation, which looks at how the health impact assessment was undertaken and if there was any added value from doing so. We have the impact evaluation, which looks at whether the recommendations have been accepted by the decision makers. And then finally, the outcome evaluation, which determines whether any anticipated positive outcomes have actually been realised, and if any negative health outcomes have been avoided. That really brings me to the end of my overview of the health impact assessment guidance. It has been a short whistle-stop tour, if you like, of the guidance documents. And what I would encourage you to do just after the webinar is over this morning is to head over to our website and have a look at the documents. They're available to download, and we trust that you'll find them both useful and practical in your own application of HIA. But just before I finish, there are a number of people that I would like to thank both for their involvement and contribution to the development of the guidance. Firstly, a special word of thanks to Ring & Piper and Ben Cave, who were lead authors in the HIA guidance. Their expertise and experience in HIA has really been invaluable in this process. I would also extend a word of thanks to the HIA Advisory Group, again, for their valuable insights from a range of perspectives, and also for the time commitment that they gave in terms of contributing to this work. We'd also like to acknowledge the external review panel, which included Dr. Monica OConnor, Erica Eisen and Katie Hirono. And we're delighted that Monica is with us today, and we'll be hearing from her shortly. We'd also like to, we're also delighted that the European Public Health Association and the International Association for Impact Assessment have endorsed the HIA guidance. And finally, but certainly by no means least, again, I would like to acknowledge my colleagues in IPH, particularly colleagues in IT, comms and policy team, for their practical support over the last number of weeks and months in terms of the design of the guidance documents and the planning and organisation of the launch today. And just finally, if you would like to get some more information or you'd like to discuss HIA further with us, we'd love to hear from you, and my details are just on the screen now. Thank you.
Thank you both, Helen and Joanna, for that really interesting presentation. And I think even for those of us who don't know a lot about HIA and those who do know a lot about HIA, there was a lot in that. Before I move to our next speaker, who's Liz Greene, just to note, as today's event is quite contained, we don't have an opportunity for questions. However, if you do have a burning question, please do add it to the Q&A function and we will follow up with you after the event. Or as Joanna said, you can email us directly on hia@publichealth.ie or info@publichealth.ie. Our next contributor is Liz Greene, and we're delighted to welcome Liz, with whom we've been working with for a number of years at this point. So Liz is a consultant in public health for policy and international health and the Programme Director for HIA at the WHO Collaborating Centre on Investment for Health and Wellbeing at Public Health Wales. She is also the lead for International Health Coordinating Centre in Public Health Wales, the International Health Coordinating Centre, and a visiting professor at the WHO Collaborating Centre for Healthy Urban Environments at the University of West of England. Liz has an extensive knowledge, understanding and practical application of HIA, health in all policies and spatial planning, and provides training, advice and guidance about HIA and health integration, among other processes. We're delighted to have you here, Liz, and looking forward to hearing what you're going to say.
Thank you very much, Suzanne. Sorry about the length of my titles. We don't do short and snappy, I'm afraid. Right, okay, I hope you can all see that. So, right, I'm just going to give you a very quick sort of 5 minutes talk about what we've done in Wales in terms of health impact assessment. It's pretty much established in Wales in 2004. And when I first started, there were very, very few health impact assessments that have been carried out, maybe a handful. And now we've got over 500 that have been carried out that we know of, that I know of. And we've worked with communities, local authorities, health boards, Welsh Government, and also we've carried out some both participatory and rapid HIAs, but also some really big strategic comprehensive health impact assessments on things like Brexit, COVID policies and climate change. So the policy context in Wales is actually very friendly to health impact assessment, and Wales has very enabling sort of environment in that respect. We're devolved government, so we have the ability to make laws and policies around health, social care, environment, spatial planning, and Welsh Government's got a very clear focus on sort of well-being and sort of sustainable development for the future. So we have a unique act, or it was in 2015, Wellbeing of the Future Generations of Wales Act. And every public body in Wales, of which there's 44, including the health boards, Welsh Government, local authorities, Public Health Wales, for example, the Environment Agency for Wales, Natural Resources Wales, all have to strive to maximise their contribution to 7 wellbeing goals. And those 7 wellbeing goals are things like a cultural Wales, a healthier Wales, a more equal Wales. And those 7 wellbeing goals really are the determinants of health, the wider determinants of health. So social, economic, environmental, and health determinants. And so although the guidance for the Wellbeing of Future Generations Act doesn't actually specify HIA or health and policy in all policies, which is, health impact assessment is one of the key drivers for that, then, but it's not explicit, but it's implicit. And it gives us a very friendly environment with which to use health impact assessment as a process. Currently, HIA is voluntary, but actually it's in an awful lot of statutory and mandatory guidance for transport plans, business cases, spatial plans. And in Public Health Wales Act 2017, HIA will be actually mandatory and statutory for public bodies in specific circumstances. This has all been put on hold because, first of all, we have Brexit, then we've had the COVID pandemic. So all our focuses have been elsewhere in terms of actually what those specific circumstances will be, but actually the legislation, the regulations for these specific circumstances are likely to come forth next year and be consulted on and then published. And some of this will be for land development plans, for climate change adaptation plans, for example. So actually, while everything's been suspended in terms of HIA activity, mainly for the Wales HIA support unit, of which I'm director, the pandemic actually did provide an opportunity to actually showcase HIA to inform and influence policy and decision. I'll tell you a little bit about that in a minute. So the Wales HIA support unit, HIA, it's in our title, but actually we're more of a health and all policies unit. We work across a wide range of sectors and topic areas, like I said, spatial planning, Brexit, climate change, housing, regeneration. We provide advice and guidance to a wide range of stakeholders, including private citizens who can email us for advice too. And we provide a range of support services, including resources, training, websites that's got all our guides, journal papers and information on. We've got an e-learning online course that's free for people. And actually we provide a lot of mentoring as well. So, like I said, in 2020 and until recently, we've suspended all of those main activities, except that it gave us the opportunity to actually utilize HIA in practice and actually, in a way, showcase it. So we carried out a series of COVID-19 HIAs in order to inform Welsh Government, health boards, the NHS and Public Health Wales about, well, what are the wider implications of some of the response policies, such as social distancing, lockdown, staying at home. We're all working from home. You can see my house in the background. And what are the implications for health, well-being and inequalities for home working? What does that actually mean for real people? And how can it affect their health and well-being? And a follow-on from these 3 HIAs about home and agile working, housing insecurity and homelessness, came out of some further work around the mental well-being impact assessment of COVID on children and young people. And that particularly looks at social isolation, their resilience, their educational disruption, and also the triple challenge, which is a combination of looking at Brexit, COVID-19 and climate change, and what are those cumulative and multifaceted impacts in Wales, and who will it affect, and what kind of population groups and how will it affect them. So in terms of for HIA, for the UK, Ireland, and global practice, I think there's a lot of value in sharing our learning, working together like we're doing today, about talking to each other to advocate for health, well-being and equity across the population so that we can maximise our contributions to health and also mitigate any negative impacts or unintended negative impacts, because when policy is being made, people don't intend to make it negative on people's health and well-being or increase inequalities. They're often unintended consequences, and HIA is a really great tool for sort of unpicking some of that. And I think these kind of conversations are also good for applying consistency in our policies, our approach, the language we use, in order to enable HIA to continue to be a key lever or driver for health in all policies. So that's it from me. I would be happy to take any questions, but we don't have a session, but you can email me, or if you're interested about anything, or look at our website. So
thank you, Liz, and congratulations on the great work that's being done in Wales. And I can highly recommend the Public Health Wales Support Unit website, which is hugely informative and has excellent resources. And I'm sure you do have lots of questions for Liz, so rest assured we will hope to run a similar event in the next few months where possibly Liz might be able to join us again. Our next speaker is Maurice Meehan. Maurice works for the Public Health Agency in Northern Ireland as Head of Health and Social Wellbeing Improvement. In this role, he leads a team focused on population health improvement and also leads within the agency on early years interventions that support the theme of giving every child the best start in life. This includes a social and emotional learning programme delivered in primary schools called Roots of Empathy, development and implementation of an infant mental health strategic framework, and evidence-based parenting programmes and family support services. Maurice is also active on the Adverse Childhood Experience agenda. You're very welcome, Maurice. Over to you.
Thank you very much, Suzanne. Firstly, on behalf of the PHA, we'd like to acknowledge and welcome the considerable innovation and knowledge leadership that the Institute of Public Health in Ireland have shown in the production of the revised HIA guidance and associated materials and resources. As Minister Swan mentioned in his video address, the updated guidance is particularly welcomed in the potential application of the methods and approaches in the context of the Making Life Better Northern Ireland Public Health Strategy. The Public Health Agency has a statutory function to develop and provide programmes and initiatives designed to secure the improvement of the health and social well-being of and reduce health inequalities of people between people and reduce health inequalities between people in Northern Ireland. Sitting within the Public Health Director of the PHA, the Health Improvement Team is responsible for a total budget of £38 million, which is a third of the total PHA budget. The team oversees the facilitation and implementation of the public health interventions on behalf of the Department of Health, including key strategies such as Protect Life, the new substance misuse strategy, Fitter Future strategy for Northern Ireland Tobacco Control strategy, and the Department of Health Home Action Strategy and Action Plan, among others. So if you can put up the first slide, please. So many of these interventions have had an impact on the outcomes for people affected by COVID-19, and particularly the 85,000 people who during COVID in Northern Ireland were in receipt of shielding letters. For example, in the work on emotional health and well-being, family support, and ensuring a key focus for our newborns in the first 1,000 days, support of isolated older people, support for ethnic minorities and migrants, and addressing drugs and alcohol misuse and obesity and respiratory health. The timing of the new guidance coincides with the agency activating a health improvement COVID rebuild and recovery plan. This process represents a 5-year integrated planning approach and plan that spans 21 thematic areas relevant to overall population health in Northern Ireland, including the groups identified here as requiring specific mitigation. The COVID-19 context has significant implications for population health because citizens at the sharpest end of health inequalities, both in Ireland, North and South, the UK 4 nations, and internationally, have been affected negatively and disproportionately. It is therefore of great considerable interest that, as Liz has referenced, that HIAs have been specifically undertaken in Wales to explore the health impacts of COVID on population groups and as part of their COVID population health planning. We'll certainly be very interested in exploring the potential HIA kind of match between the COVID population, the effects of COVID on our Northern Ireland population. If we could put up the second slide, please. So the Public Health Agency Regional Thematic Team there's a current team that are considering community-led approaches to reducing health inequalities. And that team is more than happy to engage in any further discussion on a potential reintegration of HIA guidance into policy and practice, given our previous experience of conducting HIAs, and wrap it into regular policy discussions we have with the Department of Health, Department for Communities, and Department of Agriculture, among others, for example. I think just it is interesting to maybe reflect on Liz's observations that they've moved from a handful of health impact assessments to hundreds. I think she mentioned 500. So it certainly would be fantastic to explore the potential for us to grow the overall kind of numbers of HIAs being applied in Northern Ireland across population health. That would be a fantastic ambition. As you can see in this slide, the successful public health approaches requires community development, cross-departmental and cross-sectoral links with policy development, not only in the Department of Health, but across other departments and the executive. Strategic partners with other key bodies such as Education Authority, Housing Executive, local councils, and in particular the council-led community planning partnerships are critical given the very significant influence on health and wellbeing outcomes that lies outside of health and social services. Hence, consideration and leadership in the use of health impact assessment processes beyond health and social care is critical. Community engagement and empowering approaches enabling citizens to take control of their own health must also feature heavily, particularly as the broader implications of COVID-19 on the economy and those most vulnerable emerge in the years ahead. I suppose just on reflection, Helen mentioned the establishment of the new integrated care system here in Northern Ireland, which has set out some very specifically bold objectives, including the reduction of health inequalities. So again, I think that's going to be another particularly important kind of planning context for consideration of the use of health impact assessments moving forward. So if you don't mind putting up slide 3, the final slide, please. So in conclusion, Public Health Agency welcome the health impact assessment guidance and materials launched today and look forward to following up with the Institute of Public Health in Ireland on potential applications directly across the extensive range of public health interventions necessary to drive improved outcomes. You can see in this slide examples of that tapestry of work here delivered through multiple stakeholders, all of whom have played a critical role in the Building Back Better agenda moving forward. Next steps for us would be to explore together how health impact assessment may add value to that tapestry. And we look forward to following up with that conversation with you subsequent to this launch. Thank you.
Thank you, Maurice, for the PHA perspective and a really useful insight into how this work might progress. I'd now like to introduce Dr. Monica OConnor. Monica is an EC-funded Marie Sklodowski-Curie Research Fellow working in University College Cork on her project Gender Research Ireland, and is also a member of the Cork Healthy Cities Steering Group. Monica has previously researched HIA in Ireland, Northern Ireland and Slovakia, and she has published 2 books on the topic, HIA on the Island of Ireland and Integrating HIA with the Policy Process Across the World. Some of you may have seen the RT Brainstorm article that Monica and Ben Cave co-wrote in January of this year titled, "What could we learn from a health impact assessment of COVID-19?" Over to you, Monica.
Many thanks, Suzanne. Dearest esteemed friends and colleagues, I am thrilled to be here with you today celebrating the timely launch of the Institute of Public Health HIA Guidelines. The contributions from my fellow panelists here today are so full of passion and authenticity. I am so honored to be here together. It is no secret that I am personally passionate about the possibilities of what HIA embodies, and I am also excited by the launch of these new guidelines today. I am eager to conduct research exploring the nature of HIA implementation with these new guidelines. It's fair to say I have spent a reasonable portion of my research career exploring the policy feasibility of HIA as a tool and approach. I have also always been supported in my work by the Institute of Public Health, for which I have always been so grateful. My previous all-island study of HIA practice, which Suzanne referred to just there, with a specific focus on the ways in which HIAs under study were used to inform policies, highlighted the importance of enhancing a working culture for intersectoral action for public health. Put simply, HIA implementation will flourish best in a context where intersectoral action for public health is the norm or at least welcome, and when crucially, HIA implementation is carried out in a pragmatic way. After my all-island study, curiosity led me to study implementation of a public health legislation in Slovakia, particularly the legal provision for HIA. I learned from this study that codifying HIA within national policy without corresponding support or capacity building, which includes the necessary development of useful guidelines, presents more challenges than opportunities. The previous guidelines published in 2009 by the IPH, Owen Metcalf, Claire Higgins and Teresa Lavin were very useful in facilitating the practice of HIAs. Based on conversations I have had with colleagues and friends and students across the world over the years, the previous guidelines were known globally for their pragmatism, particularly the screening tool. These newly revised guidelines we have today, carefully authored by Ringham Piper, Ben Cave, Joanna Purdy, and Helen McAvoy, continue this spirit of pragmatism. I hope this pragmatism is maintained throughout contextualized implementation too. The launch of these guidelines is happening at a crucial moment in our drive for furthering intersectoral action for public health, as endorsed within public health policy, the Healthy Ireland framework. However, Healthy Ireland does not directly outline how HIA implementation could take place, especially in addressing previously identified implementation challenges as outlined by Gillespie and McEldoon's review of HIA. I myself see this entirely as an opportunity, particularly with the launch of the guidelines today and the high-level political leadership that accompanies it, I hope. There has been no more pressing need for these guidelines than now, as we find ourselves in an unprecedented pandemic era, overshadowed only by the worsening climate change emergency and increasing global and social inequalities that have been in turn exacerbated by the global pandemic, as Liz also referred to. Last year's report of the European Anti-Poverty Network Ireland once again starkly reminded us that health inequalities worsened during COVID-19 pandemic, predominantly because of pre-existing structural inequalities. And what does health impact assessment have to do with health inequalities? HIA is a tool and approach that collates or brings together evidence on modifying or changing the adverse impact of social determinants of health from sectors including housing, employment, education, and so on. It identifies best possible outcomes that are needed to strengthen the promotion of health and health equity, and in minimizing or reducing risks, such as the widening of health inequalities. So essentially, if we are to have any hope in creating a healthy society, we need evidence of the foreseen and unforeseen impacts of policies, programs, and projects that are being designed, produced, and rolled out. And I would resonate as well what Liz was saying about a lot of those impacts. It's not done on purpose, that any unintended or intended consequences are not thought through. HIA is a way of garnering the necessary evidence we need in informing healthy public policy. And these guidelines are being launched today by the formidable Institute of Public Health Ireland. Thank you.
Thank you, Monica, for your remarks, your input into this work, and your leadership in HIA in Ireland. And now finally, I'm delighted to welcome Dr. Julian Nawaki, Technical Officer at the WHO Regional Officer for Europe. Since 2008, Julia has worked at the European Centre for Environment and Health, the WHO Regional Office for Europe, first in Rome and since 2011 in Bonn. Her work focuses especially on the development and implementation of health impact assessment, the integration of health into environmental assessments like environmental impact assessment and strategic environment assessment through the development of policy advice, as well as different capacity building and networking activities. We are delighted that you can join us today, Julia. Over to you.
Thank you very much for this invitation to join you today here in the launch. As the others, I'm really delighted about this new guidance or the updating of the other one. And I can confirm what Monica just said, that yes, your guidance is really well known, was before well known. Whoops, something went wrong. This one? No. I hope you can see my screen now. Can you give me a thumbs up if you can see?
Yes, we can see it, Monica.
Okay, thank you. So yes, the Irish guidance is well known, very well outside of Ireland, and I'm very sure that this new one will be known very much too. So where I am working is, I'm working at the WHO European Centre for Environment and Health, and our region is comprised of 53 member states. So we go well beyond Europe itself, and we try to develop here policy advice and international and regional guidelines, methods and tools to inform and to support decision-making. And we also, especially in my program, we all the time work on health impact assessment and try to integrate it further into environmental assessments. So I'm pretty sure in the trainings we once in a while organize for our member states on their request. I'm pretty sure I'm going to have a deeper look into the guidance and will use quite a bit out of it. So, and there are a lot of opportunities why we think here at WHO already since quite a long time, why health impact assessment and integrating health in environmental assessment is so important, because we all know that proposals outside of the health sector mainly influence our health. And there is a great potential therefore to prevent diseases and also to promote further health. So the health in all policy approach hasn't come just like that. It's simply a fact that many factors influence our health. And it has been already recognized since the 80s in WHO World Health Assembly resolutions. And if we look in the newer history, it's the SDGs which clearly show the link between health and environment. We have from WHO side our general working program, or the European working program, United Action for Better Health in Europe, with a whole of government and whole of society approach. So all these are opportunities where we think health impact assessment as a tool and as a process can all support this. And then, of course, we have the environmental side, and we have multilateral agreements like the UNECE ESPO Convention and its protocol on SEA, or we have in the European Union itself the directives, which all say you have to include health into the environmental assessments. And the European directives, especially in our region, go far beyond the European Union itself, because through the funding agencies or the European banks funding big projects. So they have a big influence outside of only the now, unfortunately, 27 EU countries. So how does health impact assessment implementation look in our countries? Despite this long history we're having now, we have to say it's still in the majority of our countries, it's a voluntary process still. So there is maybe a handful of countries which have it implemented through statutory processes. Some are in the process, as we heard from Wales, and others are, it's mainly a voluntary process. So we did a survey already in 2015, and we just updated it this year. So we are just in the middle of looking into the details of the results we got from these experts working on health impact assessment. And we got responses, full responses from 56 experts from 19 of our member states, and also from 9 non-European member states. And in almost half of them, health impact assessment is conducted as a standalone health impact assessment, or according to those experts. And in half of them, at least, health impacts are addressed in environmental assessments, but they are not really integrated through an explicit impact assessment. And as I said before, yes, health impact assessment is only institutionalized in a very low number of the countries. Only 15 of the participants answered yes, it's institutionalized in our country. And I have to say, I think at least 9 of the participants were from the UK. So there might be a higher proportion there. And also health impact assessment in environmental assessments is not really an established practice in most of the experience of these 56 experts. So there is still room for improvement. So when we asked, what do you want, in your opinion, is there further need for HIA and health assessment implementation in your country? The picture is pretty clear. So at the national level, more than 60% said, yes, we need further HIA and further health assessment implementation in environmental assessment. And also 50%, over 50% said it for a regional and local or municipality level. So there is really a need to further implement HIA outside according to these experts. And I'm sure the guideline will help for this. And why do we think also that it's really important in the current situation we are in with the pandemic? I think it has clearly shown that we need a health impact assessment to build forward better. It's not about building back. We don't want to go back to what we had. We want to go forward better. And health impact assessment helps us to have a holistic approach, because we need to protect the societies and we need to recover from what happened in the last 1.5 years. And environment and health are necessary elements of sustainability and for achieving SDGs. And HIA and the further integration of health assessment in EIA and SAA can support this. And we all learned pretty much that even though we know it since many, many years, I think this pandemic has clearly showed it further. A healthy economy depends on healthy population. There's no way out of it. And through HIA, we can prevent problems and higher economic costs at later stages. So it simply supports the whole of government and the whole of society approach. So congratulations again to this guidance, and I'm pretty sure I'm going to use it further in our trainings. And yes, thanks a lot for this.
Thank you, Julia, and apologies for calling you Monica earlier. And thank you for the presentation. The European region perspective is always so informative. And I'd also like to take the opportunity to acknowledge the expert guidance offered by the WHO Regional Office for Europe in so many aspects of the work that we do here at the Institute. So Julia was our final speaker this morning, and we've had an excellent panel, and I'd like to thank them all very much for their participation. As I mentioned, we unfortunately don't have time for questions this morning. Rather than host an extended session at a very busy time of the year, we've decided to run a technical seminar on the application of HIA in Q1 of next year. This will align with the development of some initial digital training resources. We plan to progress the digital training resource from next year onwards and maintain an annual point of contact with the HIA sector via seminar or conference. And ultimately, we hope to progress to a model of a support unit similar to that of our colleagues in Public Health Wales, who've been so helpful to us in developing both this publication and future planning. And I'd particularly like to thank Liz Greene for her help on this. While we do plan to ultimately undertake some policy level or national level HIAs, our main focus for the moment will be on education and training. I hope you found this morning's launch useful. All the documents and updates are on the HIA page of our website, publichealth.ie, and please feel free to contact us at any stage if you would like further information. We will have details of the next steps I have mentioned available early in 2022. For anyone who has missed the presentation this morning, there will be a recording available, so either contact us or we may distribute it to the registration list. With that, I would like to thank again the ministers for their support, the participants in today's events, the contributors to the guidance, and the IPH team in policy, communications and IT for all their work on this project. We hope to see you all at the next HIA event. Thank you.